If you sit in front of a computer for 8 to 12 hours a day and you're dealing with bad posture, neck and back pain, muscle tightness, or joint stiffness, I don't care if you work in a corporate office, work from home, or even if it's just because you spend a lot of time playing video games in front of a computer screen, you're definitely going to want to hear what I have to say. Today, I'm going to show you how you can start correcting these problems and prevent future posture-related issues in just about 8 weeks without the use of bulky exercise equipment or heavy weights and without spending hours in a gym each week. I promise you, it's not hard work, but it does take consistent, simple work, and it really is simple once you boil it all down. My name is Dr. Kyle Carroll, and I'm a licensed doctor of physical therapy. I have over a decade of combined study and work experience in the physical therapy field. I'm a longtime student and an avid video game player, which basically means that I've experienced just about all of the things that we're going to be talking about today. My job is literally to help people do this kind of stuff in person when they're coming into the clinic. And today I'm going to show you what I've actually done to myself and taught these people how to deal with what to do to deal with these issues to prevent them from becoming too big of an issue in the long term. So quick little game plan. Today we're going to talk about some of the common problems associated with prolonged desk work or computer work, some of the common postural changes that occur in the spine and in the muscles, how to go about solving these issues, why nothing that you've tried has worked before, and then ultimately my solution for you. So first, just a disclaimer, this presentation is for informational purposes only and is not intended to substitute for professional medical advice, diagnosis, or treatment. Always seek the advice and care of a qualified healthcare provider with any questions you may have regarding a medical condition or treatment. And with that out of the way, let's get going. So upper cross syndrome. This is mostly what we're going to be talking about today. It's not truly a disease or anything like that, but it is one of the most common problems that I see in this specific population in the clinic. Most desk workers, office workers, gamers, they all typically present very similarly with a lot of these things. So this is the posture that you think of when someone's at that computer all day. Think forward head, rounded shoulders, increased thoracic kyphosis or hunched forward. These are really common findings in this population. Over time, this posturing can put different muscles in the neck, the jaw, shoulders, the back, the hips, and all sorts of different problem positions that can lead to shortened muscles, like shortened muscles, say, on the base of your skull or on your pectorals, or lengthened, weaker muscles on the front of your neck or between your shoulder blades. When these imbalances go on for so long, it can create weakness in the whole system, and it requires specific strengthening to correct it. This is exactly what I help people correct in the clinic every day. And if you don't recognize or experience what I'm talking about here, this is probably not the right video for you. If this does sound like you, keep watching and we'll go into what we can do about it. Here's some of the most common problems that I see in this particular type of patient. So we've already talked about some of the postural changes like upper cross syndrome, that forward head, rounded shoulders, hunched over appearance. There's chronic neck and back pain, lots of tightness in the hip flexors or hamstrings or pectorals or in the base of the skull and the suboccipitals. A lot of people have limited mobility or stiffness in their spines. Lots of eye strain and headaches are pretty common with this stuff as well. A lot of these clients also usually present with, let's say, less than optimal physical fitness and general strength. A lot of times can either be due to the stressful jobs that they have, not having enough time to be as active as they want to be, that kind of stuff. Lastly, and probably one of the more prominent complaints that I deal with are overall poor self-image when they see their posture in the mirror or when they see themselves in pictures. No one really usually likes that hunched over forward head look. They definitely, that's one of the biggest things that they want to correct. Like I said, if any of this sounds like you, let's learn a little bit more about it, so how we can correct it in the future. So let's first talk about the spine. So you've probably heard this before, but a normal spine has what we call an S-curve. The purpose of these curves is to help dissipate the forces of gravity through our spine to maintain healthy spinal joints and intervertebral discs, the discs of the spine. When we alter this curvature over a long period of time, it ultimately changes how our spines transmit those forces, and it can lead to unnatural compression in areas that aren't meant to be compressed like that for so long. The common places for spinal pain in prolonged desk workers, and this isn't all encumbering or an exhaustive list, but this is just some of the common places, are in that upper cervical spine, so that top right there, in the cervical thoracic junction right here. So let's see, the cervical thoracic junction right here, it's basically the transition zone between the cervical spine and the thoracic spine. The next one is going to be the thoracolumbar junction, or where the thoracic spine meets the lumbar spine, or in the lumbosacral junction, where the lumbar spine meets the sacral spine. All of these points are inflection points in our spine. That's where the curve changes. So in the normal healthy S curve, it dissipates forces very well, and we don't have issues. It's when we change those curves when problems start to arise. So here's another little view of it. On the left, you have a normal spine. On the right, you have one with a little bit more exaggerated curvature, or that forward head posture, rounding, increased thoracic kyphosis, increased lumbar lordosis down here. Another one that just happens in the lower body. Notice that all these points are where the spine begins to curve or pivot in the opposite direction. So if normal forces are dissipated more evenly through the neutral or normal spine, like the one on the left, I want you to imagine how much more pressure is occurring at these particular pivot points when those curves are more exaggerated, like this guy on the right here. When this happens, those points are going to experience significantly increased forces due to gravity and how far away that the center of mass is away from that pivot point. And I actually kind of want to prove this to you, so I can show you today exactly what your body is experiencing. So let's go ahead and try this out. First, I want you to actually try something for me. Let's call it a little bit of an experiment. So first, I'm going to need you to grab a small weight, like a gallon of milk or heavy purse or backpack, something like that. Also, I'm going to do my best to keep this simple so I don't lose you, but take a moment, pause it if you need to. Grab a small weight, about 5 to 10 pounds. Okay, now that you've got that, let's go ahead, and I have a kettlebell here that I'll use. This is about 8 pounds. It's nothing too crazy. What I want you to do, let's have you hold the weight at chest height close to your body. Feel how it feels. Feel how your shoulders feel, about the forces in the shoulders. Is it straining anything? Is it relatively easy? Next, what I want you to do is hold that same item at chest height, same height, but away from your body. What do you notice? Did it get heavier? It might feel like it got heavier, but did the weight actually change weight? No, it's still an 8-pound kettlebell in my case. But basically what this is meant to show you, that out of the two different positions, when the weight is further away from the axis of rotation or the joint, in this case the shoulder, it's going to increase the amount of forces that joint experiences. Why is this important? Why is this important for me to teach you? Well, it happens in the spine. This is the exact same kind of thing that happens in our neck. So we call that exact force, we call it a torque. So in the case of the neck and the head, a typical head weighs anywhere between 10 to 12 pounds. Some studies have shown that depending on how far away the head is from the axis of rotation, like in this right picture, it's further away from where it attaches to the neck. In some people, that can increase the weight of the head from 10 to 12 pounds to up to 60 pounds. So you can 6 times the amount of weight in your head, or the amount of force that your neck experiences, depending on where your head's at. Think of all the times throughout the day when you're sitting at your desk working, hours pass, you get closer and closer, your face is getting further away from your body. Do you ever feel like your neck is super stiff and sore by the end of the day? This is why. The biomechanics actually show you why. It's because your neck is experiencing up to 6 times as much force than it's supposed to be experiencing for that long duration. So hopefully that kind of hits the point home on there's definitely things that we can modify or change. Some of the big stuff is going to be like habits, preventing ourselves from doing this or catching ourselves when we realize that we're doing it. There's definitely more involved, but that's one of the biggest things that you can do is catch yourself when you're doing this stuff. So what about posture braces? I have a lot of patients who have used posture braces, or they ask me all the time, will this work? Will this work? What's the best brand? Which one do you think I should try? The ones that I'm kind of talking about more specifically for upper cross syndrome are going to be like this one on the right here, or the ones that you put on that feel like you're putting on a bra. They're meant to keep you in that perfect posture. Now, if you've had one or used one, how did it go for you? Did it work? How often did you use it? Did you use it every day? And then ultimately, did you end up relying on using it all day, every day to keep you in that position? A lot of clients that I've had have paid a lot of money for all sorts of the posture correction braces because they all seem like a logical quick fix. And I promise you that I'm really not here to poo-poo on these braces. Like, they're not bad inherently or anything like that. I really don't think they're a complete waste of money, but they're definitely a Band-Aid fix, in my opinion. Sure, the brace is going to put you in a good posture, but do you know what usually happens? First of all, it's a very passive form of treatment, meaning it'll only maintain that posture while you wear it. So a lot of times the users become dependent on it. They're only doing that posture when they're wearing their brace. The problem is that this dependency causes them to wear it longer and longer, and ultimately the brace ends up doing all of the work in holding them in that position, and their body and their muscles don't actually have to activate to do anything at all. So all their postural muscles actually end up becoming weaker, which ultimately compounds the problem, and it can make their symptoms even worse. If you're going to use a brace to help with your posture, that's totally fine. But in my opinion, it should only be for about a week or two to help get you to feel what better positioning is like, so that you can actively strengthen your muscles to hold you in that position. That being said, to truly fix these issues, we have to train our muscles to be able to do what these braces are doing for us. If we can strengthen the weaker muscles, elongate the shortened ones, the ones that become compressed and shortened, and work to keep our bodies moving as much as possible each day, then it's really not too difficult to correct these problems. But like I said before, it does take time and a lot of consistency. This stuff doesn't just happen overnight, and you really do have to trust the process. The body needs time to adapt to the stresses that you're imposing on it to alter the mechanics or the structure of it. About ergonomics, do you think our bodies are meant to be sitting at a desk all day, every day? No, we have evolved from occupations like hunting, gathering, farming, building, etc. All that kind of stuff that requires a lot more movement, physical activity, and we move to much more sedentary jobs where we don't have to move very much at all. Now, I'm not telling you that you need to quit your office or desk job and switch to something more physically demanding. I'm not saying that at all. But what I am telling you is that you do have to counteract these things by adding more movement throughout your normal day-to-day and setting up your workstation to allow for proper ergonomics. My dad once told me there's 3 things you should never skimp out on in life: good shoes, a good mattress, and good toilet paper. I think it was actually some pretty sage advice, but my point is, why would your workstation, somewhere where you probably spend 8 to 12 hours every day, be any different? Now, this doesn't necessarily mean that you need to go and buy a convertible standing desk or a fancy walking pad or a brand new high-tech computer chair with all the levers and bells and whistles. If you're able to swing it, then by all means go for it. But what I'm talking about is making a few minor adjustments to how you sit and where your things are placed at your workstation every day. Yes, ergonomics are actually important. If you're going to sit in that position, it should at least be in a position that limits the excessive pressures and strains in the body. But what if I told you that just making those workstation changes alone won't actually solve the problem? Is it realistic to think that you're going to sit in the optimal position all day, every day? Hell no. Something I tell all of my clients is that the best position is your next position. Our bodies crave movement, and even if you're in the most optimal position for 8 hours straight, all these problems are still going to develop. The goal is to set up your workstation to limit this as much as possible while also getting you to move frequently while you're at your desk. In the first week of my 8-week posture program, I'm going to teach you what proper ergonomics look like and how you can modify your workstation to set you up for success. So all that being said, how do we fix it? Well, we've kind of touched on some of this stuff already, right? by adopting good postural habits to put our bodies in the best position that we can. Same thing with ergonomics, setting up our workstation to keep our bodies in good position to prevent those long-standing injuries or dysfunctions. Daily movement and exercise. Our bodies need to move. Whether you're busy working all day, 40 hours, 80 hours a week or not, you need to make time to exercise and move your body. That's just how we stay fit and active, and that's how we stay healthy. And then one of the easiest things you can do is actually prevent it from happening in the first place. That's what all of this is about. Helping you manage it, but ultimately prevent it from happening or getting worse in the future. So why has everything that you've tried so far been unsuccessful? Maybe there was a lack of consistency or accountability. If you've searched for YouTube video after YouTube video for things like how to fix my posture, or how to fix neck and back pain from sitting at a desk, or exercises for bad posture, etc., 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 I want to ask you, how did that go? Did you actually get any relief? I would imagine at least some of you hopefully got some sort of relief, but if you did, how long did it last? Did you actually keep up with doing those exercises, those stretches, the tips, and the tricks? I can tell you from my experience working as an orthopedic physical therapist for the past several years that most of my clients have tried it all without any lasting relief. Maybe you had unrealistic goals or expectations to start with. Maybe you were getting inadequate guidance that wasn't taking your personal situation fully into account, or the message that you were being taught wasn't too clear. Maybe you were trying Band-Aid fixes that don't actually address the root of the problem, thinking like bracing, things like that. Maybe you neglect your holistic health. If you're always anxious or stressed and fail to give your body the freedom and movement that it craves, it's important to find out how we can release some of that pent-up energy. Our jobs have a huge impact on this. So a big part of this is creating habits to help improve those aspects of your life in addition to just setting up your posture for success. So here's the ugly truth. There's no such thing as a quick fix. You get what you give, and getting started sooner is better than later. Do you want to know what the #1 barrier to physical activity is? Time. Nobody thinks they have enough time to do anything additional in their day-to-day lives. I see this all the time in the clinic where I'm working with a patient or a client on correcting these exact same posture-related problems. They're so busy at their high stress and high demand jobs, sitting at a desk for 8 to 12 hours a day, they say they've barely got time to take a break, barely have time to stand up or even go to the bathroom throughout their workday. And I get it, these concerns are entirely normal and valid. Their stress and anxiety of taking time away from work is very real. But what this tells me is that they have not yet learned how to prioritize their own health and well-being over their job. Yes, you need to be able to produce for your company or organization, but let me ask you something. If you just keep hammering and hammering away without addressing your own physical and health concerns, what good are you going to be for your company in the next 3 months, 6 months, or even 2 years from now when these problems don't go away and they start getting worse? I wish I could just say that there was a way to fix these issues instantly without any time commitment at all. Trust me, I get it. Everyone wants that, but that would be a huge lie. It's going to take some time out of your day. But the Posture Reboot program that I've designed is specifically for this particularly busy population. All that I ask is that you make 2 time commitments. The first is to find or make time for 2 to 3 60-second breaks in your normal working day to do what I call the 60-second posture reboot flow. 2 or 3 minutes. That's all this is going to take out of your working day to help keep your body out of the constant tension and strain that you're in while you're sitting at a desk all day. If you think that you can't find 2 to 3 minutes in your working day to work on your own health and wellness needs, you might not be ready for this program. But the next time you catch yourself at work between meetings or projects, scrolling Instagram or Facebook, I want you to think back to this video and ask yourself if you really still believe that you can't find the time to work on yourself. 2 to 3 minutes out of your workday. That's all it takes. The second time commitment required for this program comes from actually exercising and strengthening your body to counteract sitting at a computer all day. You might not think that your muscles need much to sit there all day in the same position, but you'd be dead wrong. I want to ask you a question. How much time do you currently set aside for regular exercise every day? I'm hoping to get a mix of anywhere between 20 minutes to about an hour a day. Now, I obviously understand that a lot of people don't get anywhere near that amount. Work is busy and stressful. I get it. Deadlines, meetings, emails. But I'm going to tell you something crazy. You can find time for at least 20 to 30 minutes per day, at least 5 days of the week. Whether it's waking up early or going to bed later, or even breaking up your workout program throughout the day, I don't care how you have to break it up, but to succeed in this program, you really need to commit to doing it. The American Heart Association, they recommend that humans get at least 150 minutes of moderate exercise per week. This program generally requires from 20 to 30 minutes a day, at least 5 days a week. It's not meant to be a moderate or a vigorous amount of exercise. I promise you that. They're not terribly hard exercises. It's just stuff you have to be doing to keep up with. And then hopefully by the end of it, when you realize how much better you feel and perform at work, I'm hoping that it opens the doors for you to start incorporating more physical activity into your daily life, progressing from just doing these posture exercises to actually training your body and all the different functional needs that we have as humans. The best part though, you really don't need a gym membership to do it. This program can be completed virtually anywhere and with minimal equipment. Your body and a set of resistance bands that you can throw into your backpack or your purse, they're all you need to successfully get through this program. Now, if you have a gym membership and want to continue to progress your training even further, please be my guest. These workouts can be progressed or regressed from any level that you desire, but the majority of my clients are going to benefit from just the bare bones level 1 exercises that I coach you through. It's not too late to help you. That's the one thing I want to make certain is you can start this process at any point. The sooner you start, the better in your journey. But even if you have significantly increased forward head posture, thoracic kyphosis, rounding of the shoulders, you have like significant postural deficits, you can improve this stuff. It'll take you a lot longer to improve it, but you're definitely able to improve those things if you're training the right stuff. So how can I help you? How can virtual coaching from me help you more effectively than if you were to just go to the PT clinic? Well, speaking from experience, usually when a patient comes back the following week when I'm in the clinic, I'll ask, how did your home exercises go? And a lot of them usually lie, telling me that they've been doing their exercises every day as prescribed or as much as they can. I hear that all the time. Ask any PT how many of their patients they actually think do their prescribed home exercise programs, and they'll probably laugh. You know how I usually get, or you know how I can tell when someone's not doing their exercises. That's how I want to phrase that. It's when I ask them, can you show me exercise X, Y, or Z? Suddenly they don't remember how to do any of the exercises, even when I'm telling them the name of the exercise. Even with all of the TheraBand and printouts that I give, I waste so much paper and ink giving out home exercise programs to my clients. And only a specific set few of them actually complete the whole thing. But let me tell you, those are the ones that get better. I really shouldn't be too harsh though. I totally get it. I was the same way. When I was a physical therapy patient, I broke my ankle playing hockey back in college. All of this ultimately led to me becoming a PT, but I definitely lied through my teeth when they asked me if I did my exercises. I pretty much only did them when I was in the clinic. And today I'm the one teaching people to do these things. But it's because I know that because I didn't do all my exercises, I never got all my foot or ankle mobility back. My stuff would be a lot better if I had actually taken their advice. So through exercise and all that, we'll target the root cause of your issues. My job is to keep you consistent and accountable. So this whole thing is set up through an app where I can track everything. Ultimately, like I said, keep you consistent and accountable. We're going to target the underlying causes. I'm going to help you set realistic goals and expectations. We'll talk about some of these during our discovery call. I'll give you my honest opinion regarding your specific situation. It's important to have realistic expectations if you want to be successful. You can't go in expecting you're going to come out with perfect posture in 8 weeks if you're starting from the very far end of the spectrum. We're going to have to create some realistic goals. I'm going to provide you with expert guidance, things like why it's important to adopt good postural habits. I do this stuff through teaching the simple version of functional anatomy and biomechanics, kind of like I showed you earlier in the video. Basically the science of why our bodies respond the way that they do in different positions or as we impose loads on them. I'm going to teach you how to properly set up your workstation for proper ergonomics. If you're at a computer desk for a third of your life, you have to set it up for success. Like I said, it's like that whole mattress or shoes or toilet paper thing. The whole program is delivered to you straight to your phone. As long as you have your phone, your body, and some resistance bands, which you'll get as part of your welcome kit, you'll have all the tools you need to get back to work with better posture, less pain, and feeling more physically healthy overall. Here's a basic rundown of what the program includes. I've taken the success I've been able to make in the clinic with my clients who actually did the work and developed it into an entire lifestyle transformation. Why? Because I've seen what good this stuff can do and what happens when clients that aren't consistent with their home programs. The whole experience, like I said, delivered straight to an app on your phone, and it helps both of us to keep track of both your completed exercises and workouts. It keeps track of some of the few daily habits that I'm going to coach you through. When you finish a workout or a habit, you just check it off in the app, and then I get notified of it. This allows us to see exactly where in the program you might be struggling or falling behind, and we can address it in our weekly coaching check-ins. You'll also get access to other helpful educational content. If you've never had a workout partner before, I can promise you it's a lot easier to stay consistent and keep up with your exercises when you have someone to hold you accountable and go through the process with you. The app also contains direct messaging, so we can message back and forth throughout the week if you have specific questions on exercises or anything else in particular. If you're ready to take the next step or aren't quite sure if this program is a good fit for you, please click the link below and fill out a discovery call application. This application will ask you questions to give me a better understanding of your situation and problems. And after that, you'll be able to book a free discovery call with me where we can talk about your specific problems and determine if this program is right for you. This call shouldn't take any longer than about 20 to 30 minutes. And I truly hope that anyone who is wishing to make this call actually took the time to watch through this video, because it pretty much tells you exactly what the program is going to entail. So I'm able to answer any questions you might have about it. Don't forget to like and follow me on Facebook and Instagram for more content at Carroll Physiotherapy. And thanks. I hope you guys have a good day.